Greetings, everybody. Brian Lane here with the Center for Health Affairs, as well as Champs Healthcare. I am blessed to have the UpHealth team here for our series regarding language services. And this time, pertaining to our series cluster, we're going to be talking about cultural awareness and sensitivity. But I want to state openly here that we are blessed to have them as our corporate sponsors since around August, I want to say, of 2022. And UpHealth is a team of innovators dedicated to building solutions that address the healthcare disparities impacting patients across the nation using telehealth. And Martti's language access solution puts certified and qualified medical interpreters within reach and one-touch simplicity in over 250 languages. It still blows me away. With access over 24/7, whether at the bedside or a mobile cart or throughout the overall healthcare system or educational institution. And Martti integrates directly with the EHR, the telehealth systems, and also enables a better patient experience investments, ensuring language access anytime, anywhere. And Martti has just published a textbook for remote and telehealth language interpretation, which we're going to hear about in just a bit. So with that, I have Tatiana, as well as Danielle, and welcome back.
Thank you for having us. We appreciate it.
Yeah, and we're very appreciative. Tatiana, you are the Director of Language Services and Advocacy, is that correct?
Yeah, Language Service Advocacy. Mm-hmm.
Okay, and then Danielle, you're the Director of Organizational Quality and Partner Support.
That's right.
Excellent, excellent. Well, welcome back. This portion of the series, what I'd like to do is talk about the cultural awareness and sensitivity. And I would love for you to tell us about deaf and hard of hearing people myths.
Sure.
Okay.
I can start off with that. So by trade, I am a nationally certified American Sign Language interpreter and have been for 17 years. I do not come from a deaf family, so what I share is just from my professional experience and exposure and what I've learned from the deaf community, especially when providing language services in a healthcare environment. So for some context, the deaf community has had sign language interpreters on site historically, right? Because it's not a spoken language, it's a visual language. So we've been in person interpreting for decades and decades and decades and decades. And then about 20 or so years ago, video interpreting solutions were started to be offered, and it became this balance of video interpreting and on-site interpreting. And there was always kind of like this inner struggle of, we always want to have on-site interpreters, but that can be really difficult based on timing and demand and location of interpreting services, especially for the folks who live in really rural communities. And then the pandemic happened, and all of a sudden we had to do a mass acceptance. Remote is really the most leveraged solution right now. And so here we are, and I won't say post-pandemic, but 3 years since the start of the pandemic, and we're really paying attention to best practices when providing remote interpreting solutions for the deaf community. And at times there's quite a bit of resistance, because through this 20+ years of diverse remote solutions, there's been an application when it's been not appropriate or not a conversation with the deaf community about when to provide a different kind of modality for interpreting services. So it's really, especially for the deaf community, about making sure that they feel included when the health system or the clinic is making a choice on how to provide language access solutions. And we're getting to a point in the remote interpreting, on-site interpreting, deaf patient and provider relationship of how to really have that conversation to show sensitivity of when you're going to take a 3D language and make it 2D on a video remote screen.
Well, then what I'd also like to know is what are the different stigmas around language access for both the deaf as well as pertaining to hard of hearing individuals?
Sure. So I think one of the things most notable that can be really frustrating for the deaf community is that people will assume that they can write in English, and that if I don't have an interpreter, or I forgot to book one, or the solution we suggested, like on-site doesn't show up, it's okay. You can just write back and forth. And remember, sign language is its own language. It has all the grammar and syntax and everything that comes with any other language. It has in its own. And so English is actually then their second language. And so now you're asking a deaf person to communicate either reading lips, you think shouting louder will make it easier for them to understand you, or over enunciating your speech, or writing back and forth is actually going to be an equitable language solution for them. And so for the deaf community, it can feel really oppressive when sensitivity to the solution you offer is not provided, and you just make a decision for them, and you make that really gross assumption that English is equivalent to sign language.
That's interesting. I can imagine healthcare professionals may risk providing insufficient care to professionals or to the patients if those professionals lack the cultural awareness. What are the risks, that our healthcare professionals are currently facing when not providing culturally appropriate patient-centered care?
Yeah, we were talking a little bit about this in the previous session. We can talk about, hospital-wide type of risks or risks at hospital levels, but there's also another set of risks that are there when the provider doesn't do anything to solve that or to bridge that gap. So it can be, not building enough rapport, not gaining trust, losing that trust that maybe was gained before. Because honestly, if I'm a patient, I'm a provider, a patient, an interpreter, all that. So when I'm the patient, I want to make sure there's certain things that I can communicate, that they can understand me, that I'm able to understand. And even for an English-speaking person talking to an English-speaking provider, things can be very scary and difficult. And as Danielle was saying, instead of saying most difficult time is court and hospital, I would say even most vulnerable times. So there's a lot of risk when you're not providing culturally and linguistically appropriate patient-centered care. Outcomes. I've heard many different stories. I've learned many different things that are related to culture that I hear when I moved here to the States, and it's people feeling undermined or not, that they're not an important person because they don't know the language. Right. So many times, we see in hospitals that they think the person doesn't have enough knowledge to understand healthcare because they don't speak English. Mm-hmm. And I have had the privilege to interpret for many different people. And even when they don't have the educational level that many other people have, they do understand their body. They do understand what they need to do. They do understand their care, their health, and their medications, like on top of all that. So treatment compliance is also at risk. When we don't provide culturally and linguistically appropriate patient-centered care, when people don't feel that they can go back and ask questions, they cannot go back and interact with their healthcare providers, all of that relationship is just in jeopardy. So I can go on and on.
It's great. I love your passion. So thank you for that. What risks do deaf as well as hard of hearing people face when presented with insufficient culturally appropriate care?
I think it's very similar to what Tati's talking about, right? There are definitely cultural dynamics to be aware of and sensitive to, and working with qualified interpreters who help you navigate. Interpreters are not cultural experts. For many years, we've talked about that, but interpreters, qualified interpreters, are experts at picking up on cues that might lead to a misunderstanding and then help navigate that path to get folks to understand each other. So, and then of course being sensitive as a provider. So nodding does not mean consent or I understand, right? So as a deaf person would be sitting here in the room and I'm interpreting, they're nodding because they say they understand what I'm saying, not because they're answering your question.
Oh, that's a
right?
great point. Yeah, great
And
point.
sign language, very visual. It's your whole body and their feedback and eye contact. So being sensitive to that and trusting the interpreter when they tell you, this is the interpreter speaking, please wait for me to answer the question before you assume the nod, right? Because the deaf person is actually trying to tell me, the interpreter, that they understand what I'm signing. Or they have facial expressions that may misalign with what the provider is thinking. So the risks are jumping to conclusions. The risks are when you have a healthcare staff member who took college sign language and thinks that they can interpret because they think it's just a visual word for word of English when it's not. And so really first respecting that ASL is its own language, and two, respecting that the interpreter will do their job and just take a beat. Because the risk is you can jump to conclusions and make assumptions or completely disregard the need for an interpreter. And what we have to remember for sign language users, for non-English speakers, is that when you're in a healthcare environment, who has the power? Who has the perceived power? It's the clinician. And so you're going to have a patient who doesn't speak the language, isn't a part of the dominant culture, may have their first encounters with healthcare or going down a healthcare path that's really scary. I mean, they just got diagnosed with something really terrifying. They're less likely to advocate for their language access needs because they perceive that they don't have the power in the room. And so when you don't provide an interpreter or an unqualified interpreter, or we're not patient with the process, we just tear away even more at that power dynamic and that autonomy.
Yeah, and there's research already in place. I mean, many different studies that have to do with what are the consequences of not providing language access to individuals who are deaf or hard of hearing, or those who don't speak English. They're hearing individuals, but they don't speak English. Yeah.
I mean, think about how hard it is for us to advocate on our own as English speakers for our own healthcare, right? How we all have moments in our life where we really have to be strong advocates, but now you have to depend on them continuing to provide care and language access for you. It can become very complicated very quickly if there's not that sensitivity to the disadvantage of not speaking the dominant language.
What resources are there for healthcare professionals to educate themselves about language access?
You can call us. We'll be happy to talk to you all day long.
Can you tell?
A little bit.
Well, first of all, you definitely need to have something in place in your hospital, someone in charge of language services, language access, whether it's a coordinator or manager. That's your first person there. That's going to be the person helping educate the whole system. Of course, there are resources outside, to help you with that. There are the culturally and linguistically appropriate service standards, which are also known as class standards. Mm-hmm. There's a roadmap. There are many resources from there that hospitals can take advantage of. You can definitely partner with many other language access experts to help you with that. The National Council on Interpreting in Healthcare, NCHC, has multiple webinars, different resources that can be shared with you. And in general, there are now many experts that can provide consultative services to your hospitals to make sure that you build that either department or service, your plan, your documentation, all of that. So there are many different ways to educate yourself, and of course, get your community involved in all this. It's not just, okay, let me go somewhere else to find information. No, you have the community of individuals who speak Vietnamese, those who use American Sign Language, those who speak Spanish. Let's have conversations with them to see what their needs are, how, get them involved in activities in the hospital so that they understand how you operate, but you also understand how they operate.
Yeah.
That's great. That's great. And John, I see you're back. Hey, I want to introduce you. John is the regional sales director for the Eastern U.S. I'm going to give you kind of the closing opportunity here for part two. But what are the website links that Danielle was hinting at regarding your organization?
So you can reach us. You can Google search us and find us through UpHealth as an organization. So as a larger umbrella organization, we're known as UpHealth. But as far as language access specifically, look up Martti, MARTTI, and our full name is Martti by UpHealth. So we're one product under the UpHealth umbrella. But you can find us through those avenues. And thank you for reintroducing me, Brian. I had some technical difficulties there.
No worries, no worries. But I wanted to make sure folks knew who you were. So thank you again. We're gonna say goodbye to everybody and take a time out. And we appreciate everyone's participation. So thank you all.